Now let's learn about the important causes of elevated uric acid levels and role of allopurinol in controlling these elevated levels. Now you must be wondering why uric acid levels increase in our body. We'll help you with this as well. Elevated uric acid levels are due to metabolic disorder, which is associated with the excessive synthesis of purines, followed by their metabolism, leading to increased uric acid levels. When circulating uric acid levels are high, greater than 6 to 7 mg per deciliter, the uric acid can form crystals, monosodium urate, in synovial fluid of joint, which initiate an inflammatory reaction that leads to the pain and swelling associated with the gout. Now, how we can prevent this inflammation and swelling? Of course, they will be done by eradicating the root cause behind that, which are the crystals built up in the joint, as I already mentioned. Allopurinol does this by reducing the amount of uric acid made by body cells. This is the reason why we use it in chronic gouty attacks. Second reason here is the excessive breakdown of purines. There are few anti-cancerous agents that increase the uric acid levels because chemotherapy rays are so strong that they even break the purines in the body. Increased purine levels lead to increased uric acid levels, where we need allopurinol to inhibit its synthesis. So, allopurinol is used to treat secondary hyperuricemia, that is increased uric acid levels in patients receiving cancer chemotherapies. These patients can have increased uric acid levels due to release of uric acid from the dying cancer cells. Next is low excretion of uric acid from our body. Here we can say maybe the uric acid production is normal, but either it is not excreted out via kidney due to reduced renal function, or due to the increase in renal absorption of uric acid leading to increase in uric acid that will cause hyperuricemia. So, allopurinol is used to prevent the nephropathy due to elevated uric acid levels. Lastly, but the most important reason is the dietary source. Above 3 points are the major indications of allopurinol. Apart from that, dietary source is also the main reason for increased uric acid levels. It is good to know that 1/3 of reason is associated with the kind of diet one takes, while 2/3 is due to the breakdown of purines within the cell. Now, if we talk about Mr. Henry here, his diet majorly contains red meat, seafood, organ meat, and all type of alcoholic beverages. These are the major reason for his increased uric acid levels. It is ideal to advise patient to reduce his intake of purine-rich foods like meat. Apart from using allopurinol, it can be controlled by advising him to drink plenty of water. Apple cider vinegars is also beneficial in this regard. Dilute it and drink. Eat generous amount of fibrous food, fruits, green leafy fresh vegetables, and milk. Up till now, we have learned about the allopurinol, its mode of action, causes of elevated uric acid levels, and how allopurinol helps to reduce these levels and play its active role. Further, we can learn about pharmacokinetics, dosage, side effect, interaction, contraindications in our next videos. So keep watching sqadia.com.